Trips over a step, injuring her ankle. Examination reveals tenderness on the lateral malleolus, and X-ray demonstrates there is a undisplaced fracture distal to the syndesmosis. What is the best course of the action? Here, this is the distal to the syndesmosis. There is a undisplaced fracture distal to the syndesmosis. Undisplaced, that means the fracture is usually good. Healing rate will be improved. Here the options are the application of ankle boot, surgical fixation, application of full leg plaster cast, application of external fixator, application of Ilijarov frame. So first of all, let's see fracture classification of the ankle joint, which is the Weber classification. In Weber classification, the fracture is classified as A, B, and C. In Weber classification, the B type of fracture, when it occurs the syndesmosis, that means it is the joining between the tibia and fibula. So when there is joining between the tibia and fibula, in this area there is a fracture, it is called the Danish Weber type B classification. And when this fracture occurs distal to this B, that means the syndesmosis, it is A type of the Weber classification. And when the fracture occurs the proximal or upper part of the B fracture, then it is the Weber classification type C. So A when is below, C when is above, and at the point which is syndesmosis. So here the syndesmosis is the first option, and the classification is based on the syndesmosis. At the level of syndesmosis, there is the type B. When below, then A. When above, there is the C. And this classification is very, very important regarding the management option. First of all, Weber type A, that means the below the syndesmosis. In this condition, the option is the ankle boot. And the C, which is the above the syndesmosis, it is the operative fixation. So operative fixation always in case of C, and in case of A, always the ankle boot. And in case of Weber B, it is different. In case of the Weber B, there is either operative fixation or there is the ankle boot. When there is the less injury and no displacement, in this condition ankle boot may be used. But in case of the severe form of injury or displaced fracture, in this condition operative fixation. So Weber type B, which is the level of the syndesmosis, there are two options of the management, but other area there is definitive. That means in case of Weber A, it is ankle boot. In case of Weber C, it is operative fixation. And in this question, as there is the undisplaced fracture and distal to syndesmosis, that means it is the Weber type A. And in case of Weber type A, it is the application of the ankle boot. And Weber type B and C, there is the surgical fixation. In case of Weber type B, when there is displaced, then it is the surgical fixation. When non-displaced, then ankle boot.